Well, hello everybody. This is Dr. Carmen Bryant, and this is Car Chronicles. How you guys doing? You doing all right? You ready? Let's do this. I just wanted to respond to someone that made a comment, or kind of ask a question, comment. And I've answered this question before. I made a video about this before, but the comment question is how are they all the same? You know, how is it possible that they're all the same? Each one of them are exactly the same. So let's keep in mind that you're dealing with a personality disorder. And when you're dealing with a personality disorder, if you go into the DSM-5, which is the Diagnostic and Statistical Manual of Psychiatric Disorders, number 5, which should hopefully be updated soon, but when you go into that is basically like the medical, most of you guys know, it's like the medical, it's a medical Bible of mental health, and it gives you the description of different disorders so that you can identify it for mental health professionals or medical professionals, psychiatrists, psychologists, social workers, mental health professionals, to identify a specific type of disorder. If you look at, for example, post-traumatic stress disorder is classified under anxiety disorder, but is also classified like traumatic, anxiety disorders. And a lot of the features are the same, and there's certain amount of symptoms that you have to qualify you for that particular disorder. For example, hypervigilance, you may have that feeling that the outer body experience feels like you're in a dream state, depression, anxiety. There's certain symptoms you're going to have, which is a cluster of symptoms that will classify you for that particular disorder. Now, when you're dealing with narcissistic personality disorder, there are 9 symptoms or characteristics that we use in order to identify somebody that has narcissistic personality disorder, the disorder. You can have the traits, but each one of those, you have to have at least 5 out of 9. Dr. Romani says at least about 6, but according to the DSM, you have to have 5 out of 9 of those symptoms to qualify you for having, or qualify a person to have those particular, the diagnosis. Now, some people you can look and say they got all 9 of the symptoms, but they're not consistent. They're not permanent. They're not consistent. And over time, like a person said, is like, wow, they're predictable, because that regardless of who the person is, those particular symptoms that you see, the grandiosity, like the somatic or the cerebral narcissist, those particular symptoms, that regardless of who they go to, it's always the exact same pattern, And it is a pattern that is dysfunctional in their personal life and in the life of other people. And so when you're talking about these people that look the same, is because they have the exact same disorder. They may be different people and display it differently, but they have the diagnosis, they have the symptoms. So this is Dr. Carmen Bryant, and we were talking about how are the narcissists all the same. And so this is part 2. So, Car Chronicles. Remember, as I was saying before, when you're dealing with a narcissist, there's the disorder, and then there are the traits. In order to qualify for the disorder, you've got to meet at least 5 out of the 9 traits, characteristics that are in the DSM. And for some people, they fit all 9 of them, but they're not consistent, meaning that they can, they may fluctuate between the different ones. They may fluctuate between the 9, but they're not consistent. There's not a pattern, there's a pattern of behavior, but it's not a pattern that is consistent, that from person to person, from situation to situation, you can almost guarantee, just like the person was saying on Facebook, is like they are predictable. They are predictable because that particular narcissist has those traits, and they're very consistent. No matter what person, no matter what they do, it's almost like you can mouth the words of what they're going to say and how they're going to do it. For those people that don't have the disorder, they just fluctuate between the different symptoms. They're not consistent, and they may cause problems of not to a point where they're literally a disability. That's what it is, a disability. Now, for some people, you've had personal experiences with these narcissists. And remember, you still have classes and categories, and subcategories. You have the somatic narcissist that is into somatic, soma, the body, the looks. They're the ones that, have got to be seen, they sleep around a lot. They're promiscuous. Then you have those of the cerebral. They get their fuel out of, thought, out of education, out of intellect, out of intelligence. Not all narcissists cheat, believe it or not, depending on what role they play in society. Then you have the lower grade narcissists and the higher grade narcissists. You have those that are in the medium, so there are different levels, of narcissism. Then you have some that are You know, like the overt, the very obvious. You know, those are the ones that usually will get a DV charge or get put in jail. Those are the wild ones. Those are the ones you got to watch out for. Then you have the covert. Covert just means that they are highly sensitive. They're very highly sensitive, and they are more prone to be hurt by scrutiny, by judgment. You know, they're very sensitive when it comes to being picked on or misconstrued as, you know, that constructive criticism. They can't handle that kind of stuff, and so they try to hide and the grandiosity that goes along with it. So there are different categories and subcategories. Then you have some people that say all narcissists stink. The ones that I've run into, I haven't really met any narcissists that really stink like that. I mean, they may, some of them, but those are the particular ones that you have attracted, you know. And then there are some that are high class, you know, have money, some that don't have money. So they're different but the traits themselves are very consistent. Very consistent.